rights to act on. Really, the outcomes of this pandemic are what really matter. Limitations provide an opportunity to make a lasting positive impact for the future. And it would only be fair to those who get the vaccine that those without it are not out potentially creating problems, right? Well, ideally that would be the case, but we don't live in an ideal or even remotely fair world. And the reality is that limitations cannot be placed in the world's current state, as Isaac will address.
This is an easy question to answer from the perspective if we were to look specifically at North Carolina or in America as a whole. However, we live in a global pandemic to where the entire world must be considered. There are different areas of the world. Most of the vaccines and the research facilities are in Eastern Europe and America and Canada. However, we still have to think about Africa, South America, Middle East, Southeastern Asia, and Western Europe, because a lot of those places do not have the resources, the PPE, or the vaccines in general to be able to distribute them to help people go towards the path of getting everyone vaccinated. The World Health Organization predicts that this could take up to 2.5 years. And if we still experience delays in first world countries in getting the vaccines out on time, this could take much longer. Therefore, to put an ethical responsibility or it's a mandate on people to put limitations on other countries who do not have the means to be able to vaccinate their people effectively, it's an unethical demand. It's kind of like you have these people in a different bubble, don't give them the access to resources in the first wave. We don't give them access to PPE, and then we turn around and point at them and say, hey, we're going to put limitations to you because you haven't been vaccinated. Just kind of like a double-edged sword. So circumstance has always been extending beyond just the region. There's obviously the geographical distances, but eventually enough vaccines will be able to be made, with more being created, especially now that Russia and their Sputnik vaccine. The distribution and the logistics of vaccinating people are another layer of complexity.
Looking into the distribution and the availability of the vaccine, the distribution throughout the world and the United States, it is extremely vital for looking at the argument whether it is ethical to place limitations on anybody that does not have the vaccine. Currently, nearly 2 million people in North Carolina have been vaccinated. 59.6 million people, 2 million doses have been given in North Carolina, 59.6 million in America, and 200.6 million for the world. And in the world, 2.57, so around 2.5 to 3 people out of 100 people in the world are fully vaccinated. This obviously is a problem. We cannot just step out into society and go get a vaccine. As college students, we are not currently able to just go to our nearest health center and get our vaccines. So almost a year into the pandemic, not everyone has the ability to get a vaccine. And in order for ethical limitations to be placed on anyone, there needs to be total access to the vaccine globally. Overall, we're not in a global state currently in which the vaccine has been widely administered. Therefore, it's not ethical to place limitations and restrictions. However, over time, when all areas and all people in the world have had access to it, it is perfectly ethical to limit those without vaccines in travel restrictions and school application restrictions. So right now it is not ethical, but as time continues and more vaccines are given, it will be ethical to place those limitations. Thank you.
Thank you. That was right on time there. Our timer is closing out here. Thank you so much for that presentation, Morris Hill. I'm going to set the timer for another 7 minutes, and we'll again let everyone know at the 1 minute time frame. I'm going to draw the next name from our, let's see, we got to mix them up here. All right, let's see. So our next team presenter will be Belmont Abbey And as I understand it, everyone from Belmont Abbey is here. Is that correct?
That's correct.
Okay, great. Thank you. And just one moment. We'll start now. Thank you.
First, thank you for the opportunity to explore the ethical considerations of COVID-19 vaccinations. My name is Cedrica Ellison, and on behalf of the Belmont Abbey College Ethics Bowl team, I would like to introduce our stance. While we recognize that COVID-19 is a proven threat and that vaccinations are a unique tool in efforts to return to a sense of normalcy in community, we would argue that placing limitations on people who are not currently vaccinated is an unethical approach. Instead, we recommend that vaccinations are highly encouraged and made freely available to the public while retaining effective safety measures recommended by the CDC and other community leaders. To help explain our stance, Blake Traylor will introduce our ethical foundations, ensuring that our advocacy is tied to both specific issue and more holistic societal considerations. Next, Carter Keller will consider concerns specific to limitations based on vaccination records. Nothing at the time is questioned this is asked matter of our advocacy. Finally, Kaylee Guffey will explain how to apply ethical safeguards within communities and conclude our team's presentation. With that, I'll turn it over to Blake.
Thank you, Cedrica. Our ethical foundation today comes from the concept of individual liberty that is balanced with our own responsibility to the community. Now, liberty may most frequently be cited to have originated with John Stuart Mill, who argued that a person ought to have both bodily autonomy and authority over their decisions. Now, this is particularly true when it comes to mandating actions that could have an adverse effect on individuals' lives and their physical health. It is important to note that the COVID-19 vaccine is still new, which limits both its availability and its testing on particular populations, including pregnant women, children, the elderly, or immunocompromised individuals. It would not be ethical to create a stratified society based on the mandation of a vaccine that may inadvertently cause harm. Furthermore, regardless of if there are any harms to the vaccine or not, an individual ought to, above all, have bodily autonomy. A government must always prioritize an individual's freedom of choice in regards to what happens with their body. Yet Mill also noted that power may be authorized over a member of the community in order to prevent harm to others. Safety of the community still should or must be the counterweight to personal decisions in regards to bodily autonomy. And we believe that this justifies continued mandates for social distancing, mask wearing, and other reasonable covenants in which communities have partaken. These measures on their own do not pose any health risks to the individual that are partaking in these actions, nor do they violate an individual's bodily autonomy, while they do ensure that harm is prevented to the community at large. And with that, I'm going to pass the torch on now to Carter, and we're going to hear about applications for individual liberty.
All right, thank you, Blake. So we will now walk through how these principles would connect with tangible examples in the present reality that's before us. So when a government entity passes ordinances or mandates requiring vaccination for COVID-19, they are, by the very fact, restricting liberty and the right to personal autonomy. Even more so, they are taking away the personal responsibility of the individual and the community. Therefore, by the ethical foundation we have provided, it would be unethical for the government to require vaccination, whether for travel, religious services, essential service, employment, or etc. Now, on the contrary, the private market, if given the freedom of discretion to limit certain activity, can allow for the preservation of personal freedom, personal responsibility and liberty. If one business decides not to allow indoor dining until vaccinations hit a certain percentage in the local community, which is an indirect source of information, then this does not infringe upon the liberty of any individual or the community as a whole. It is an act of personal choice of the business and exercises responsibility for their community and exercises their own personal liberty. Now, staff interacting with the public, such as teachers in schools, Walmart employees, and others serving as an employee or staff member in different organizations, they don't have access to medical information on the regular basis, and for a particular reason, privacy. The medical information of one individual need not be the business of those who don't normally get that information when working with people. There's a pressing reality where some individuals may not be eligible to obtain a vaccine and or not be able to take the vaccine due to a medical condition or complications from the vaccine. Simply put, the gatekeeper does not need to know someone has such a condition if they don't already get that information beforehand, and or if they're ineligible to receive the vaccine. And so now to pass it off, I will hand this off to Kaylee, who will talk about how to effectively protect our communities from the coronavirus in light of these present realities, as specifically, and conclude our presentation.
Thank you, Carter. In our current state, we have learned to live in community despite restrictions, and our numbers of new cases are currently plummeting. According to the New York Times on January 9th, the U.S. saw 252,129 new cases. On February 18th, the U.S. reported only 70,874. Although winter weather may slightly increase or decrease testing capacity nationwide, our numbers have been near or below 100,000 since the beginning of February. Targeted measures for non-vaccinated people won't work. Universal measures, however, can remain effective until community spread has been successfully suppressed. In layman's terms, we believe that everyone operating under the same guidelines, such as mandatory masking and consistent social distancing, will be the most effective way to continue to suppress the spread of COVID-19. According to the CDC, double masking and maintaining a 6-foot social distancing practice reduces the transmission rate of COVID-19 down 96.4%. We would like to reemphasize that we are not advocating against getting the vaccine, but we are advocating against restricting individual liberties on account of vaccination records. We tie our advocacy to our current conditions, understanding that unforeseen changes or challenges could result in the need to reconsider these issues. However, we believe that our stance within our current conditions balances the need to uphold individual liberty with our responsibility to our communities. With that, we conclude our presentation and look forward to hearing from our colleagues.
Thank you so much to our Belmont Abbey team. And I think this shows that as was mentioned earlier by our presenting sponsor, the non-threatening discussion and communication can be done, and the Ethics Bowl is a great place to show that, I think. All right, we'll have our next team. Holding up the two to pick from here, and that is Pfeiffer University. Is our Pfeiffer team ready?
I believe we are.
All right, great. We'll start now.
Thank you for the opportunity to discuss this topic. It is the stance of the Pfeiffer team on whether or not it is ethical to place limitations on vaccines for people who have chosen not to be vaccinated. We believe that it is, in fact, ethical. We believe this on the basis of utilitarianism, or the idea of doing the most good for the most people. We believe that the risk of exposing certain groups of people to the virus is too great to allow people who have chosen not to be vaccinated to go out and go unmasked and things of that nature. We understand that current state, not everyone can be vaccinated. However, we use this stance on the assumption that this is after all groups, at least in the US, are able to be vaccinated. To further our stance, we will have first Athena talk about some personal experiences, and then we will have Haley further our stance, and then Athena will close.
Thank you, Drew. So I'm going to explain some personal reasons, because I know that if we look at large scales and just numbers, we can actually take away from the fact that these are real people and our goal is to protect them. So I know for me, my sister has an autoimmune disorder, so she can't get the vaccine because she can't get shots, or even like the flu vaccine, because it affects her horribly. So for me and my family, we're going to have to get the shot to help protect her. And if we blow that up on a larger scale, that's exactly what herd immunity is. And by doing so, we can help protect those who, for medical reasons, cannot get the shot, which can still very largely impact slowing the spread down and saving lives at the end of the day. So I'm going to further explain this, I'm going to pass it to Haley.
Thank you, Anna. As my other teammates stated, we do believe that it is ethical to place limitations on people who choose not to be vaccinated. Like Anna went into detail, public vaccination allows people to feel more safe within the community, and like she mentioned, encourages herd immunity around the people that are unable to receive the vaccine, such as the autoimmune or the immunocompromised and children, which should have the choice. But the vaccine allows, like I said, some people to feel safer and is a step closer to normal life. And the science behind the vaccine is groundbreaking, and ideally everyone would receive the vaccine so that no limitations or penalties have to be enacted. But of course, pardoning those that are immunocompromised and pregnant women and children. But we also acknowledge that this is America and that America is founded on individualism, and not everyone chooses to follow the social distancing and mask requirements since the pandemic has started since last March. But as Drew mentioned, our theory of utilitarianism, we believe that vaccinating everyone and placing limitations on those that choose not to be vaccinated provides the greatest amount of safety for the largest number of people. And to implement that, like public school systems and higher education institutions, they could require vaccination cards or vaccination records, as is already in place today. And just a step up from that would be jobs requiring vaccination cards or vaccination records to ensure that they have a safe workspace for their employees. And now I'm going to pass to Athena to conclude.
Thank you so much, Haley. We believe it is ethical to place restrictions on those who haven't gotten the vaccine, because before the vaccine was even available, we already lived with restrictions, and we currently still live with them now. Only one person can go visit you in the hospital. You have to go alone to your appointments, wear a mask, stay 6 feet apart, things that you hear every day. When this idea of vaccination certification is not new by any means at all. We have these things in place in public education already. You have to have certain vaccinations in order to go to school. Other countries already have some systems in place, kind of similar. China, in order to get on any public transportation or go into a restaurant, you have to have an app that says you're symptom-free. In Chile, if you've recovered from the vaccine, you carry around a vaccination certification. It's important that we get vaccinated when it becomes readily available, because human beings are social creatures. We really need each other to survive. We have to place restrictions on those who do not get vaccinated, because it's important to take care of other members of society. As Haley said, yeah, America has many building blocks, but it's our duty to take care of one another. I know we want to travel again and see the new baby that was just born and hug her grandparents, and that's why our team took this stance, because it's really important to do what's best for one another. With that, we yield the rest of our time. Thank you so much.
Thank you so much, our team from Pfeiffer. Thank you. So I don't think there's any need to pull out the next name of our presenters, because that will be North Carolina Wesleyan. Thank you so much, and let me get the timer ready one more time here. All right, is North Carolina Wesleyan ready?
We are ready. Can you understand me well with this mask on?
Can certainly understand you, yes.
All right, excellent. Just thought I'd ask.
If you're in a setting where you need to have it on, we want you to have it on.
Oh, absolutely.
But thank you for checking. Okay, we're ready to start.
Yes, ma'am. Good morning. We, on behalf of North Carolina Wesleyan, would like to thank the NCICU and the volunteers for putting on the Ethics Bowl, especially considering the circumstances of this year. My name is Trey Robertson, and my teammates are Chastity, Honesty, Catherine, and Abigail. Our position on the COVID-19 vaccine is that we find it to be ethical to place restrictions on individuals who have not been vaccinated. We justify our position using rule utilitarianism, which you'll hear a little bit more about later from my teammate and the ethical guru, Honesty. Then my teammates Chastity, Catherine, and Abigail will follow up with more facts and justifications. Finally, I will conclude by summarizing the entirety of the argument. Thank you, and I hand it off now to Honesty.
Thank you, Trey. As our team captain stated, Trey, we believe that it is ethically sound and responsible to place restrictions on individuals who have not received the COVID-19 vaccine. We have arrived at our position using rural utilitarianism. This ethical theory asserts that an action is morally just as it adheres to a rule, and its consequences produce the greatest amount of good for the greatest amount of people. We believe in order to enjoy the liberties of life, for example, traveling or enjoying amusement parks, limitations must be placed on those individuals who have not been vaccinated for COVID-19, just to protect the general population. The rule here being centered around restrictions on those who have not been vaccinated, and the utilitarianism is protecting society, bringing the greatest amount of good for the greatest amount of people, the greatest amount of good being safety, and the greatest amount of people being society. My team members, Catherine, Chastity, and Abigail, will argue and provide evidence to support this ethical theory, and I will hand it over to Catherine.
Thank you, Honesty. Both the CDC and FDA scientists have evaluated reports from people who experience any allergic reactions after getting a COVID-19 vaccine. Anaphylaxis is a common allergic reaction for those who experience an insect bite or food allergy, have experienced it after a COVID-19 vaccine. Although it is deemed rare and has occurred in approximately 2 to 5 people per million vaccinated in the US alone, based on reports reported by VAERS. This kind of allergic reaction almost occurs within 30 minutes after vaccination. Fortunately, doctors have provided medication to effectively and immediately treat patients who experience anaphylaxis following vaccination. And I pass this over to Abigail.
Thank you, Catherine. One positive of placing restrictions on individuals who are not vaccinated is that the majority of individuals will be vaccinated. This will lead to herd immunity. Herd immunity is when a sufficient proportion of the population is immune through vaccinations, and this will lessen the likelihood of the illness spreading again. Even individuals who are not able to be vaccinated will still be protected because of the majority of the community being immune through the vaccination. If there are some people who cannot get the vaccination due to allergies, they will still not pose a threat because of the wide majority of people who are already being vaccinated. And I will pass it on to Chastity.
Thank you, Abigail. According to an article from the CDC, the measles outbreak is a good example of herd immunity. 93 to 95% of the population is immune to measles, so an outbreak is very unlikely to occur again. This is because the majority of the population is already vaccinated for measles. Even though everyone doesn't have the vaccine, the majority of the vaccinated population saves us from another outbreak. According to Hopkins Medicine, the COVID-19 vaccine has a 95% effectiveness rate so far. Because of this, we feel like everyone should be vaccinated. Once more people are vaccinated and become immune, we as a general population can move back to a sense of normalcy sooner. Even if people do get sick from the vaccine, herd immunity will decrease the likelihood of another outbreak occurring. A lot of people feel like the COVID-19 vaccine is unrealistically dangerous, when in all reality, the side effects of the vaccine are no worse than the disease itself. Bell's palsy is an example of a rare side effect that some people have experienced from getting the vaccine. However, it is not caused directly from the vaccine itself. And the likelihood of developing the disorder after getting the vaccine is the same as if a person were never to get it. So basically just saying the vaccine does not cause Bell palsy. And with that being said, I would like to hand it back over to Trey.
Thank you, Chastity. I'd like to restate our position as we find it ethical to place the restriction on individuals who have not been vaccinated, and we have done so under rule utilitarianism, which, as you've heard from Honesty, is a long-term positive effect when concept is perceived as a rule, and it applies, the most good for the most people. As you heard from Catherine, one of our justifications is that the rarity of side effects indicates a general safety of the vaccine, which justifies restriction. And our teammate Abigail then went on to state the relationship between vaccination and herd immunity, which was further built upon by Chastity. In closing, I would like to thank NCICU once again and the volunteers. We yield the remainder of our time.
Thank you so much, Team North Carolina Wesleyan. And excuse me, I will mention just for our observers that as I understand it, you're all actually in the same room together, and that is why you have on masks. Is that correct? Or that you're in close proximity?
Yes, ma'am.
That's right. So I just wanted to, I'm sure some of our observers may have been wondering. And we love the snow scene behind you there. That doesn't happen very much in Eastern North Carolina. Having grown up in Eastern North Carolina, I can say that. So that's a lovely view, and it's nice that it's in the picture and not on the roads. Okay,
Thank
we're
you.
going to open this up, and I'm going to move mine back to gallery view because we do have a few minutes left. We will be pulled back into the main room at 10:58. And it's now 10:45. So we have a few minutes that we can ask our judges, moderators, and sponsors who are in the room who might be able to provide some feedback to our teams. And then we'll open it up to our teams to provide feedback to each other.